In the not-too-distant future, patients will share personal health data and harness the power of that data and peer-to-peer consult to aid in their diagnosis and treatment options. To tell us more about this new vision of healthcare, here's Marina Gorbis, author of The Nature of the Future, Dispatches from the Social Structured World. And it's good to have you back here at TVO, Marina.
Nice to be back.
Well, for those who may have missed the first part of our conversation, which took place earlier in the summer, let's just start with this word social structured and have you remind us what a social structured world is.
Yes, the social structured world is the term I use to really talk about new way of creating value. So it basically involves micro contributions, small contributions by large networks of people using social tools and technologies. So in the health arena, where it leads to, for example, people are increasingly collecting a lot of their personal health data. I don't know about people in Canada, but a lot of people in Silicon Valley and other places in the US, they wear various kinds of devices that measure their health outcomes, so they measure their body temperature, their...
Sorry, during the day?
During the day.
During the course of the day, they wear all this kind of stuff?
Fitbit or up, like a little bracelet. Sometimes they look like jewelry. Sometimes you wear them on your body.
You Californians are so avant-garde on all this stuff.
Oh, it's people from all over the world that are doing it.
But what are these devices recording?
Oh, different devices record different things. It can record your temperature. It can record your blood pressure. It can record your pulse, galvanic response, all kinds of things. More and more of these devices, more and more things that are being measured. And there's a movement behind it that's called quantified self movement. And it's interesting because the first meeting of the quantified self movement took place at the Institute for the Future, and there were probably 10 people who showed up, and they were asking each other, what do you measure? And what do you measure? How do you do it? What kind of tools do you use? So now it's hundreds and thousands of people, and it's a global movement. But basically, these people are tracking all kinds of health indicators, behavior indicators, and now there are various kinds of platforms where they can aggregate that data. So two things are happening. First of all, if you measure yourself in depth, imagine going to your doctor, and your doctor usually doesn't like when you come in and you already Googled your symptoms, right? And it irritates them a lot.
Well, because he or she thinks they're the health professional, not you.
Exactly, but you just have a few symptoms and you look them up and you go to your doctor and you say, can it be this or can it be that? And they don't like that. Imagine somebody coming in with reams and reams of very personal data. One of the people who was on the Institute board, Larry Smart, who is a computer scientist, he's been tracking his own health indicators for years and self-diagnosed Crohn's disease based on his internal bacterial level that he's been tracking for a long time. It's a very interesting case. So imagine now going to the doctor where you have a lot more information about yourself and you bring all of that data to your doctor.
In your experience, do doctors appreciate that?
Most doctors don't appreciate it for now. There are some doctors who will work with that data and increasingly are seeing that that's something that just reality, that people have a lot more personal data that they're working with.
So there's going to be, if this is going to work out the way you think it will, there is going to have to be a mind shift in the way the medical profession approaches its patients going forward. Fair to say?
I would say fair to say, yeah.
Are we on that road yet?
I think there are a few doctors, very early stages. There are a few people, there are pioneers like Larry Smart who are doing this kind of work. At this point, it is a lot of work to track all of these indicators, but the tools are there. There are more and more platforms for people to do this. People are also exchanging what they're using and suggesting to each other. They're kind of a community around it. So it's becoming easier and easier. A lot more companies are producing these wearable sensing devices. So I think it's going to become reality. If you are a diabetic, you've already been doing it for a long time because diabetics, so people who work with diabetes patients and doctors who know they're already exposed to that and know how to work with it. Except now it's not just diabetes, it's many, and it's just regular people without any kind of conditions.
So let's go to the year 2021 and take us through the kind of hypothetical visit to the doctor's office that you think a sort of changed medical profession by that time and a more savvy, engaged patient Tell us about that relationship and how that appointment might go.
So I might come in to you if you're my doctor, and I have lots and lots of data on myself, and that data is been analyzed and shows you certain patterns, and doctor has access to that kind of data. You may be already part of a community where you said, okay, I'm having these kind of symptoms, you know, what could it be? So people are crowdsourcing ideas for what condition you might have.
You're crowdsourcing my diagnosis.
Yes. And you know what? As I was on the airplane, I picked up the paper, or one, I forget, maybe it was something else, a magazine, and there was just an announcement of a new company, a startup called CrowdMed, to do precisely that. So it's basically, CrowdMed allows you to crowdsource your diagnosis. And it could be professionals, it could be doctors who are participating in it, or it could be other people with no medical degree. So this is already happening. Now, it's maybe not likely that they will diagnose you exactly, but maybe they will narrow it down to maybe, you know, look at this condition, maybe it's this condition, maybe it's this. So you're already coming in to the doctor, if you're coming to the doctor, with some preconceived idea of what this might have, what you might have.
And does the doctor in the year 2021 take the test results that you are going to bring in, all of that, those reams of information, and accept that holus bolus, or is the doctor going to repeat all those tests and do his own or her own thing?
If you need tests, you'll probably have tests done. It may be already recommended by the software or by the crowd what tests you need to do. The other piece of it, though, is so the other side of it. So people have a lot more information, and they come already, they have certain savviness about themselves and their conditions. The other side of it is artificial intelligence. So if you look at software like IBM Watson, it can diagnose diseases. So in one of the demos, it diagnosed Lyme disease. It can diagnose some conditions better than doctors. And if you think about it, why that may be, there are hundreds and thousands of new medical articles that are published probably every day. No doctor, no human doctor can access all of that latest information. So in this case, software comes to the rescue. And software, it's doctor working in symbiosis with this artificial intelligence that produces probably the best kind of results.
Let me ask a question that comes at it from the other direction, which is, the genome has been sequenced for, you know, quite a while now already, right? Craig Venter, how many years ago did he do it? I mean, it's maybe 20 years or something already. Should we not be here already in some respects?
Yeah.
What do you think?
It turns out, this is interesting, it turns out that we're a lot more complicated than our genetic makeup. And every time we reach a new level of discovery, we discover something else that we don't know. So we know the genome to be sequenced, but what it turns out is that genetic information just gives us idea about certain predispositions that we have to conditions, but it's not enough. The story is much more complicated. We also have proteins, and proteins is what allows us for the gene expression. And we haven't really uncovered all the ways that proteins play a role in our personalized health. So that's a much larger project to uncover all the ways that proteins fold and how it results in gene expression. It's a much more complicated computational issue, and so we're years away from knowing that. So the puzzle got more complicated. On top of it, what we are discovering is all the bacteria and microbiome. So it turns out that we have 10 times more bacterial cells in and on our body than human cells. And all these cells are interacting with themselves, and they're interacting with us in very interesting ways. And we don't understand the nature of those interactions. For example, we know that some of our bacteria in our gut determine some of our emotional states, like the feeling of fear or the feeling of anxiety.
Are you talking epigenetics here?
Epigenetic is additional complication.
Okay.
So we've got genetics, we've got
proteins,
proteomics, which is proteins. We've got microbiome, which is bacteria, and then epigenetics, which is interactions between our genes and the environment. And we've known for a long time that environment has a huge influence on our health, but we didn't understand it at the genetic level and at the level that it can be passed on for generations.
Marina, my head is hurting.
I know.
Let's talk about this study of 38 pregnant women who were at or near the World Trade Center on 9/11. As it relates to all of what we've just been talking about, tell us what you've learned about that.
So this is a great example of sort of epigenetics at work. So during 9/11, there were some women who were pregnant at the time, and some of them developed PTSD, post-traumatic stress syndrome. And so the study looked at women who developed PTSD compared to women who didn't. And what they found is that the level, their saliva composition was different between PTSD and not PTSD women. And then they tested children who was born to these women, and it turned out that these changes in saliva, these hormonal changes, really endured into the next generation, and sometimes probably into the next generation. And that's really a good example of what epigenetics is all about. It's changes at the level that are being passed on across generations.
And the implications of that are what?
The implications of that is that for us to truly have personalized medicine, it's a really long proposition. There are some things that you can determine from just doing genetic testing. There are certain conditions that you can predict that they're going to happen. But there are many other things that we don't know the exact nature of interactions to say, okay, you're definitely going to develop this condition, or this is how we can cure this particular condition, because there are so many complex interactions involved.
Are you sure that the future that you are describing here is better than what we've got right now?
And tell me, what do we have right now?
Well,
in what way?
Let's, for argument's sake, let's say that, and the medical profession will object to the way I'm putting this, but just for the purposes of our discussion here, let's say we have a more paternalistic healthcare system right now, where you go to the doctor, and the doctor basically doesn't really want to hear from you about what you think you've got, because he or she's got 10 or 15 years of medical training, and you went on a website. And so the doctor is going to explain and tell you and be in charge of your care. The future you are describing is something that is akin much more to a partnership, where the doctor will not feel territorial about that information, will maybe even encourage you to help in the finding out of what's wrong with you. And my question is, are you sure that that medical system of the future is actually going to be better in terms of patient care, in terms of outcomes, in terms of costs, better than what we have today?
I hope it's going to be better, because what it does is, in that sort of paternalistic system, and the system we have now is, as you know, we have a lot of people who are highly specialized in one discipline. And actually, whenever you specialize in one discipline, that's something that software does better. That level of specialization, if you have that level of specialization, software can probably do it better. But what we have lack of, and what we are really all in need of, is we need a partner. We need a doctor who is a partner, who kind of sees connections between things and patterns, and who really talks to us to do the kind of things that machines cannot do, to see that maybe you're stressed, or maybe your family environment is not the right environment, or maybe this machine is not picking up this, or maybe you need these kinds of tests. So actually, to me, this whole direction of having your own information and having artificial intelligence and smart software, it allows the doctor to be more of a human being. It actually humanizes the profession.
So you hope it will be better, but obviously we can't be sure it's going to be better. Do you think patients will prefer that kind of a system?
I think for a lot of patients, particularly for people who are able to deal with that kind of information, and that's why I say today that being able to really interact with data and information, it's not the kind of skill that only statistics people will need to have, or college graduates. We will be interacting with a lot more data on a daily basis, so we all need to be proficient in that.
I'll give you one little example, and admittedly this is this is an example of my own from 10 years ago. Back problems. Couldn't move, couldn't get out of bed, like literally could not walk. And a doctor came on the scene and he said, okay, here's what we're going to do. We're going to practice old-fashioned paternalistic medicine here. You're going to shut up and do what I tell you to do, and I'm going to get you better, okay? And I was in such agony, I just said, yes, sir, whatever you want. And you know what? It worked. And I'm walking again. that did well. How do I put this? I did well by that kind of paternalistic medicine.
Yes.
You're in charge, I'm shutting up, I'll do what you say, you got me better. Which is why I come back to this. That's the system we've all grown up with. So how do we get from where we are today to where you think we're going?
I just think that what it does, and maybe on certain occasions you would want that kind of paternalistic care, and you say, you know, too much information, can't deal with it, just tell me what to do. But on other occasions, you may want to have and discover a lot more information on your own. So I just think it expands the range of possibilities for care.
How about privacy? If you're crowdsourcing stuff, it doesn't have to be diagnosis, but information at the very least, what do we do about privacy issues?
Well, there are various ways on these platforms where people don't have to disclose their personal information. You can anonymize it and make it anonymous. And so obviously privacy concerns are paramount in these platforms, and hopefully people are building those privacy designs into these platforms. But on the other hand, if you go to sites like Patients Like Me or Cure Together, when people are in pain, it's amazing what kind of information they are willing to disclose to the community, assuming this community is going to help them.
And I guess we all have to sort of reevaluate our sense of privacy nowadays, given that, you know, the generations coming up behind us, they're living their entire lives on Facebook and Twitter and so on, and they got lots of private information out there, and they don't seem to care that they're leaving this
And I'm not sure that they don't care or they have no choices, but I do think that building in privacy and ownership of a particular kind of data is important as part of this evolution.
Okay, let me follow up with the personal health data that either you're going to crowdsource or that you're going to find out because you're wearing all these gizmos on your body. I want to bring up the example of Hugh, is it Reinhoff? Is that how he pronounced it? Reinhoff? Okay, my daughter's DNA. Tell us that story, if you would.
So Hugh is a biostatistician, and his daughter had some symptoms that no doctor could diagnose. So Hugh, being a biostatistician, he posted her genome on the web and started the site called My Daughter's DNA, and encouraged anybody who has whose children have similar symptoms to start sharing information and for people to be looking at that. And there were people from Bulgaria and other places where they started sort of self-diagnosing what conditions and basically crowdsourcing these kinds of decisions, and they were incredibly helpful.
What did they, I mean, how did it move the yardsticks?
I know that for the family in Bulgaria, they helped diagnose that particular condition that the daughter had.
So she actually made progress in terms of her health by doing this kind of sharing of information.
Seeking treatment,
How about clinical trials? Are patients doing their own clinical trials online as well?
Not online, and in the real world. There's a platform called Genamera, which is basically a citizen science clinical trials platform. You can suggest a clinical trial you want to run. For example, you may want to run a trial on whether drinking green tea increases your energy level, and they'll help you recruit participants in the study. They will give you templates for running the trial, and then they'll help you analyze the data. So they give you all the pieces for doing a clinical trial. Now, you probably can't run a clinical trial yet with thousands and thousands of people, but maybe you can run a clinical trial with 50 people or 100 people. So that's just the beginnings of that sort of opening up the whole domain of clinical trials.
But going to this example and then the one of Hugh's and My Daughter's DNA before that, how do these people even connect with each other in the first place?
They find each other through various kinds of online communities. They meet. These communities, they're pretty viral. They spread. You know, people are interested. There's always this. At the Institute, we have this notion of biocitizens. It's people who are connecting around biological information. And if you have a particular chronic disease, you're always looking for communities. There's so many communities for diabetics and people with prostate cancer and all of that. So it's kind of building and integrating into some existing communities.
Do you see any downside in this?
I mean, clearly the downside is filtering the information and filtering what's noise and what's real. But what's interesting within those communities, it's not that all those people are amateurs. There are some people who are professionals, and there are doctors who are participating as part of it. And in some ways, they're amplifying each other's capabilities.
But I do have to ask the question that you always get asked when you deal with crowdsourcing, which is, yes, there will be brilliant medical professionals participating and worthy people and interested citizens and so on, but there are mischief makers out there too. And what do you do about that?
Yeah, and when you build a platform, the design of the platform becomes really, really important, because you can't ever build a community and just create a platform, open it up, and leave it be, because there's always going to be some facilitation, some management, some design decisions required. So building that capability onto these platforms is really, really important.
Let me read something Jonathan Cohn wrote in the Atlantic magazine just earlier this year on this issue of healthcare that we're talking about. Healthcare already represents, he writes, 1/6 of America's gross domestic product, and that share is growing, placing an ever larger strain on paychecks, corporate profits, and government resources. Figuring out how to manage this cost growth, how to meet the aging population's medical needs without bankrupting the country, has become the central economic policy challenge of our time. Do you think this new futuristic approach to healthcare really can lower costs somewhere down the road?
I think that a lot of things will need to happen to lower costs down the road. I think this is just one piece. And the piece I think that it enables us to do is really focus more on prevention rather than on taking care of disease.
Sickness treatment.
Right. So that case I was talking about Larry Smar, so Larry self-diagnosed Crohn's disease before he had any symptoms. And if you talk to him, he will tell you that by the time you get symptoms, you're in a basically critical disease state. So our ability to self-diagnose and see and become experts in our bodies, it enables a lot more prevention to happen. And hopefully that will result in some cost savings.
I'm smiling because one thing that doctors could always take satisfaction in is knowing that they could never be replaced, because people are always going to get sick and you're always going to need somebody to treat your sickness. However, the co-founder of Sun Microsystems, I don't know how to say his name, is it Vinod Khosla? Khosla.
Mm-hmm.
He wrote, quote, "A world mostly without doctors, at least average ones, is not only reasonable, but also more likely than not." Are we getting to a point where doctors need to look over their shoulders because they may be obsolete before we know it?
I think we all need to be looking over our shoulders, including doctors, and particular kind of doctors, particular kind of, the number of X-ray specialists. X-ray can be read by machines today. So particular specialties, as I said, the more specialized and the more rote or routine operations anybody's involved in. And by the way, it doesn't matter if you're a doctor or a lawyer or anything else. All of these sort of routine operations are being replaced by software.
Software? Give me an example. What's a procedure that software now does?
X-ray, reading your X-ray, reading your, for example, dermatology, scanning for various kinds of marks to see whether it's cancerous or not. All of that kind of, if you have tremendous amount of data, if you have pictures and you've scanned them and you said, okay, this has cancer and that has not, it's easy to then pattern and say, oh, this doesn't fit the pattern, or it does fit the pattern.
We're still going to need an oncologist at the end of the day, though, to open us up and take it out.
Hopefully you will, yes.
So the specialists, maybe the GPs may be perhaps more at risk, but the specialists we're still going to need.
I think it's the other way around. I think it's the specialists that are being replaced. So somebody who specializes on one part of the body and knows all about that part of the body, but can't connect it to other things. I think we'll always need people who can look at and make connections between different things.
Okay, but if we're crowdsourcing primary care, which is what the general practitioner does, then the GP is obsolete. We still need that specialist to carve us open and take out the cancer.
Well, it's a surgeon, yeah, and
surgeons. So tell your kids to become
serious
surgical specialists.
Surgeon for now.
That's got the possibility.
Yes.
And one last thing on this, then. Do you think? I know governments have been trying to get us to do this for 25 years, but it seems like an awfully tough sledding. Are we eventually, finally, moving from a sickness treatment system to a truly health promotion, health care system?
I think it's happening in spurts, and there are some people who are already kind of moving in that direction, and a lot of those people are self-organizing and doing it outside of what the government is doing. It's people who have access to information, resources, and other things.
As my dad always says, the future, she ain't what she used to be.
Right.
The nature of the future, dispatches from the social structured world. Marina Gorbis, we've really enjoyed having you on TVO. Thanks so much for coming here from California.
Thank you.
Support Ontario's public television. Donate at tvo.org.